Hi, I'm Dr. Emily, a board-certified neuropsychologist and author of Don't Wait and See, a book designed for parents to help you navigate exactly what to do when you're worried about your child's development. So today I want to talk with you about whether it really matters who does your child's evaluation. So parents will ask me this question a lot, particularly when they learn that some providers have really long wait times and other providers are out of network for insurance. Now the short answer in my opinion is yes, it does matter who does your child's evaluation, and I want to walk you through why I think so. Now, psychoeducational and neuropsychological evaluations involve giving standardized tests. Now, in theory, standardized test scores should be pretty much the same regardless of who gives the test. And this is true for most children, in my opinion, but I do think that there are some exceptions to this. If your child is little, meaning kind of 5 or under, if they have significant cognitive challenges, and that includes significant language delays, if they have some challenging behaviors, or if they have a medical condition such as epilepsy, which creates a moment-to-moment variability in their functioning, it can be much more difficult to get an accurate read on what they're capable of doing. So if your child presents with one or more of these variables, working with an experienced provider becomes that much more important. But now, while testing is standardized, interpretation of test results is not. And I would argue this is the most important reason why you want to carefully evaluate any provider that you are thinking of seeing. When I say that interpretation of test results is not standardized, what I mean is that the test data, the data that comes out of testing, needs to be translated into meaningful information. You don't take your child in for an evaluation to get a bunch of numbers out of the process. You want answers to specific questions. You want to know, does my child meet criteria for a particular diagnosis? Why aren't they learning as easily as their peers? Why don't they have friends? And you want to know what to do once these questions are answered. So how do you and teachers and anyone else working with your child help? You need a roadmap about what to do next to help your child based on their specific pattern of strengths and weaknesses. How the test data is interpreted and how much of a roadmap you are given depends on the provider that you see. Unfortunately, I regularly see evaluations where providers will describe the test results, telling you which scores are age appropriate, which scores are below expectations, without really getting into what your child's overall pattern of test results actually means about how they process information. Now, this information is crucial if you really want to know how to help your child. There's no easy way to find out if a provider will really take the time to kind of dig deeply into your child's test performance and write a helpful evaluation with specific recommendations, but I do have some tips. First, when you're looking for a provider, ask around. Word of mouth is usually a great way to find out about good providers. In addition to thinking about asking other parents, think about asking people who work with and care for your child. So thinking about teachers, pediatricians, therapists. These are people who will come across evaluations on a pretty regular basis and therefore are in a good position to walk you through some of the providers who've given them the most helpful information. If you start hearing the same name from different people, that's a great sign that you're headed in the right direction. When you reach out to a potential provider, ask about exactly who will be working with your child through the process. Perhaps there's a supervising psychologist, but a trainee or a technician will be doing the bulk of the work with your child. If so, find out about that person's background and experience too, and also ask about who will be interpreting the data and writing the report. Review all of the information that you can find online about a potential provider. Can you find out about where they trained, where they've worked? Does their website describe experience that's similar to what you need? And also look to see whether they are board certified. For psychologists, and that includes neuropsychologists, the American Board of Professional Psychology, also known as ABPP, is the most widely recognized agency for board certification. Now, board certification is not required to practice, but if someone has it, it means they went through several additional years worth of evaluation and testing to show their competence in the field. Finally, try and talk with the provider. While this may not always be possible, many providers, especially those in private practice, are happy to have brief conversations with families. During this time, you can tell them a little about your child and ask about their experience in this particular area. You can also ask about what type of information about your child they would expect you to have at the end of this process. In closing, remember that the person who interprets your child's test results is very important. Having an accurate understanding of your child's needs and how best to help them is crucial in supporting skill building moving forward and allowing your child to reach their full potential.